Hello, this is David Papa. I'm the personal injury guru. And on today's show, we have a surgical nurse that is going to have the opportunity to speak with us. And the reason I thought that was important is because a lot of people have a lot of fears and concerns if, in fact, they have to have surgery. And one of the things that I was concerned about myself when I had surgery was, are they going to talk to me about it? Are they going to educate me about this? Are they going to talk to me about the pros and the cons and the risks completely? Are they going to be able to make me feel comfortable? Are they going to show me that they really do care? And is there always going to be somebody with me? It's just the unknown. So I'm trying to get rid of the fear of the unknown by bringing Mandy in. And she's been a nurse for many years. She's been an operating room nurse for probably 20 plus years. And she has an amazing amount of experience. And once you hear from her, you'll realize that she loves her job. She loves this type of work. She loves people. She wants to make sure they're happy and that they feel comfortable and confident. She wants to make sure they're educated, and she's there for them. We're going to talk about having a surgery, the day you show up at the surgery center, who's with you, what types of things that they cover and what they go over with you, and everything from laying on the gurney to getting the IV in to being taken to the ER, who's in the ER, what types of procedures they do, leaving the ER, how they stay with you when you wake up, you're with someone. It's all going to be about making you feel a little bit more confident about the unknown. Many people have had surgery and they've seen this firsthand, but there's a lot of people that haven't that in the future may have surgery. And again, the reason I'm doing this podcast is I want to make sure that I can reach out to people and let them know that this is a concern. I think that enough people that I know that I've had, clients, friends, family, and even myself, that I thought it was worth putting out there. So we will be right back with Mandy, and I'll be happy to discuss that with her and make sure that she kind of makes everyone feel a little bit better about having surgery if you need it. And again, this is David Papa, and I am the personal injury guru. We'll be right back.
This is the Personal Injury Guru Show with attorney David Papa.
Hey, this is David Papa, the Personal Injury Guru, and today I'm here with surgical nurse Mandy. How you doing today?
I'm good. How are you?
I'm doing great, thanks. And Mandy works at CSI here in Clearwater, which is Comprehensive Spine Institute. Is that right?
That's correct.
All right. Why don't you tell us a little bit about your education and background and how you became a surgical nurse?
So I originally started out in the operating room as a physician assistant. I went to college. I started out as an education major, and I decided that teaching was not my forte. I really only wanted to be a teacher to have the summers off. I always loved medicine. I started looking at different jobs. I suddenly found that being a surgical tech in the operating room was something that sounded interesting. So I finished that as a certificate program in a community college. I did that for 10 years.
Wow. And in those 10 years, you're in the ER.
In the OR.
Did I say ER? Yes, OR, the operating room, because she's a surgical nurse. I stayed corrected. And as you're in the operating room, kind of put us in that atmosphere. Is it very stressful? I've never been in the operating room awake.
That's
I've had a couple of surgeries, but I damn will make sure that I'm asleep when it happens.
Right. It can be very stressful, but it's also a very relaxed environment. It's something that we do every day. I have people tell me all the time, I'm very nervous. And I said, that's okay for you to be nervous because I'm not. I mean, that's my home. That's where I live. That's everything I know. But there are times that it can be stressful. But the good thing is that when you've been in the OR for a long time and everybody in the room is comfortable in the OR, we know what to do in those stressful environments.
Right, because it's a teamwork concept.
Absolutely, absolutely. Everybody has a place and everybody has a part.
Okay. Are there any things that in a surgery that can pop up that are unexpected that cause a little bit of a panic? Does that happen?
For sure. Bleeding. I mean, when you're doing surgery, there's going to be blood. If you hit a bleeder and, everybody has to kind of concentrate on the goal of getting the bleeding stopped. And once that, is controlled, we move on and smooth sailing after that.
Right. And as in that situation, what types of surgeries were you seeing? Was it A to Z or any particular?
Oh, I did everything. I did everything from open heart surgery to orthopedic to spine surgery to general surgery, everything.
And was there any particular surgery that you found more interesting or focused on more than the other, or was it just all the same and 100% focus and that's it?
The spine surgery is definitely more focused. You're working around a spinal cord, cardiac surgery, you're working around the heart. Yeah. Those tend to be a little bit more intense surgeries.
Okay, and are they long surgeries? I mean, what was the length of some of these surgeries?
Some are long. Even some of this, when I first did a lot of spine surgery, we did 8 and 10 hour scoliosis corrections. Cardiac surgeries can be 5 or 6 hours. Some are very short, and it can be anywhere from 20 to 30 minutes to 8 to 10 hours is probably the longest surgery I've done.
Wow. Okay, so after you got finished doing that, you moved on.
Correct.
Okay.
I loved my job as a surgical tech,
right.
But what I was lacking was knowing what happened to my patients before and after surgery. I really wanted to follow them, see how they did, know who they were. I mean, every day people came in and out of my OR. They were there for a short period, but I knew nothing about them.
Right.
So I decided that I wanted to go back to school, and I worked as a surgical tech during the day, 7 to 3, and I would go to school from 6 to 10 every night to work on finishing enough credits to get my bachelor's degree.
Wow, that's dedication.
I love the OR. I love medicine. I love taking care of people, and that was my ultimate goal.
Wow, well that's thank God we have people like you around, because that's amazing. It really is.
I love my job.
That's great. Okay, so let's talk a little bit about CSI. When you started there and what type of work you do there.
I just had my 5-year anniversary of working at
Congratulations.
Comprehensive Spine Institute. There's nowhere else I'd rather work. It's a great team. Everybody works together. Mm-hmm. The surgeons are phenomenal. Everybody is very dedicated to making sure people get better.
Right. I've seen that from them.
Mm-hmm. I am a physician assistant there. I also do a lot of work in the operating room at our surgery center. Anywhere from getting people prepared for surgery in the preoperative sense of it to the intra-op during surgery, and once they're done, once they go home, following up back in the clinic.
And I want to talk a little bit about that. If somebody, and this is for the benefit of everyone out there that had an accident and they may need surgery, whether it's elbow, wrist, knees, spine surgery. Or, I've had surgeries myself. I've had a knee surgery recently from one of your doctors over there, Dr. Bonsala. It was very successful. And I've had many of my clients have been there. And they've all said the same thing, great results and great people. So for the people out there that have never had surgery before, it's scary. It really is. There's a lot of fear that goes into it. People are afraid they won't wake up. They're afraid they'll get paralyzed. They're afraid of all these different things that go on. How do you calm those people down? How do you talk to those people?
The biggest key for preparation of surgery is education.
Okay.
Making sure that people know exactly what to expect, because it's easier to explain to somebody before surgery what to expect than after they've had anesthesia, they're groggy waking up, and they don't know afterwards what to expect. If they understand, that what risks and complications and what to expect that are normal, then it's usually much easier for them to go through.
Right, because I know that when I've had a few different clients of mine that are patients of yours, those are the things that they express to me, because what I try to do is when I find out my clients are having surgery, the first thing I do is I ask them to come in and sit down with me. And I say, how do you feel about this? Are you okay? And what concerns do you have? And have you addressed them yet with the doctor? Mm-hmm. Because I want to make sure they're completely, like you said, educated. I say I just want to be completely informed and advised about this, because I'm concerned because, I refer them to you guys because I trust you guys. Mm-hmm. I really do. And I trust the doctors there. And if I didn't, we wouldn't be having this conversation.
Correct.
And the point is, I went there myself, so I send my clients where I would go too. And when I see that, my biggest concern is with them is don't go into this with the fear of unknown. And I think that was the biggest fear a lot of them have was, well, they told me, but I'm just not sure about what happens under these circumstances or what could happen. And I always say, make the phone call. Mm-hmm. Meet the doctor once more before you go in. And I think that you hit it right on the nose. If you educate people and inform them, it seems to take the fear away.
100%, 100%. I tell people, you're going to leave, even when they come in for their preoperative visit, you're going to have more questions once you leave, because we are going through tons of information today, and I want you to make a list. And, these are the days that I'm here in the office, and I want you to call. Any question, there are no stupid questions.
Right.
Ask all the questions you need, because that's my job, is to be here and make sure that you are fully knowledgeable of what you're about to have done.
And it's not just your job. You can tell you put your heart into it, and I think that people see that.
I do love my job. I mean, I love taking care of people. I mean, everybody says you do what you love, whether you get paid or not. If obviously money makes the world go round, but if I could do it and for free, I would do it anytime.
Well, that's awesome.
Yeah.
Yeah. So I know that I've had people, like I said, so they've gone in there, and do you have like a situation where, you arrive? Let's talk about arrival. I mean, you arrive at the surgery center. Kind of tell us what happens when you arrive and what the steps are.
So once patients arrive, they get checked in. Everybody receives an armband. It says your name, your date of birth, any allergies that you may have, all of that pertinent information. Because if Joe Smith shows up the same day that Joe B. Smith shows up, you have to make sure that there's the right person.
Sure.
And we will check your armband 5-10 times. We'll ask you to repeat your name. We'll ask you your date of birth, because we don't want any mistakes.
Right.
Once you get checked in, they take you back to the preoperative area. They always usually tell you to wear something comfortable. We'll have you put on a surgical gown, and that's for your own safety. When you have surgery, you don't want anything constricting.
Oh, okay. See, I wondered what that was, because when I was in there with getting my knee surgery done this past Monday, they said you got to put this gown on, but nothing else. And then you're like, well, that's a bit, all right, that's fine. But I never really knew why.
Mostly because when you use cautery to cauterize bleeders during surgery, and there's always a risk of fires. You worry about fire. You worry about laying on elastic or bundled up fabric for too long. You can get a pressure sore, all that kind of stuff. But that's our job, is to protect you while you're asleep. So
okay, you said fire?
Yeah, there's cautery is an electric Bovie instrument that we use that heats up, and it cauterizes the end of the blood vessels, and that's what stops the bleeding.
Oh, see, I just learned something new.
Yeah.
Okay, well, all right, very good. Well, that's why we're here.
All these things we have to worry about.
Yes, well, but that's the key. I prefer that you know that.
Correct.
Rather than me knowing it.
Yes, for sure. For sure.
Oh my gosh. Okay, so I'm sorry. We can continue and.
So we have you change into a gown,
yep.
And then they'll usually get started. They'll get an IV started, and that's what they will use to put you to sleep, to give you pain medicine after surgery, all of that stuff. It's usually one stick, and that's it. So a lot of people are very nervous about needles. You have one stick, and everything goes through that same IV.
Now, I have terrible veins, and I mean so bad. So when I showed up, and it was funny because the nurse came over, and she's like, oh, no, you're fine. I'm like, oh, really? I don't have veins. People sometimes have a real hard time finding my vein, and it takes a few, The
sticks. Good thing as nurses in an operating room, we know where to find veins.
Oh, my God, you did. She went right here, and I still got the dot right there into the vein. That's where she went. There's she went right in. She said, it's done. I'm like, really?
Yeah.
It said, yeah, it's done. You're all set now. I was like, well, that's the biggest concern I had going in, believe it or not.
Once that's in, then it's usually smooth sailing for people.
Yeah.
People will usually wait a little bit. If there's other procedures going on ahead of you, we have you come in a little bit early just so that everything's ready to go.
Right.
But yeah, once you've gotten to in the gurney waiting, you're pretty much, your pre-op is set, and we're just waiting to get started.
Right. I noticed that when I was there, after they got me set on the gurney, then the anesthesiologist comes over.
Correct. He'll come over and ask lots of questions, any history of problems with anesthesia.
Right.
A lot of people, say that they get really nauseous. There's great medications that we use through the IV, and even afterwards, oral medications that are great for nausea. We've learned a lot over the years. And so there's lots of things that make that very minimal.
Yeah, they did mention that to me, and I said, I got a bit nauseous once before, and he said, no problem, we'll give you something for it, and you'll wake up, you'll be fine. And I had no nauseousness whatsoever.
Yeah, that's the key. Because if people get sick, you're already in pain, and then you're throwing up, it's miserable after surgery.
You don't need that.
Yeah, so the more we know ahead of time, again, back to education, we know how to treat you better.
Right. No, it was great. And I remember after that, I'm being, they take me into the operating room, and I was still awake.
Yeah.
You know, and I'm looking around, and I'm thinking, boy, I'd rather be asleep right now, because you get a little, the anticipation's there. But once I get in the operating room, they asked me to move myself a little bit to help them move me over to the operating table.
Correct.
And they helped me and assisted me, and everything went really smooth. And then they separated my arms a little bit from my body, and
Yep.
And then I remember the doctor coming up to me. I'm like, I said, no, I'm still awake, pal. I remember looking at him like, no. Yeah, let's wait a few minutes here. But the anesthesiologist behind said, you're going to be out. Start from 100, you'll be out in 2 seconds.
Yeah,
like,
most people
right.
don't make it to 90.
I didn't make it to 98.
Yeah.
I remember saying 99, 98. It was like a real funny thought. Like, oh, good night.
Yeah, the medication always wins.
Yeah, it does, doesn't it?
But it makes people very comfortable. You drift off, you don't even know it. And then people wake up very smooth also. You know, there's no struggling. Our anesthesiologist at the surgery center is fantastic.
Right.
He's done this, 20 plus years, and it's a very safe environment.
And throughout my episodes that we always talk about, I mention that experience is everything.
100%.
And I want people to understand that, because when you're looking for an attorney, when you're looking for a doctor, when you're looking to get surgery done, experience is the most important thing out there, because people simply get better with time.
Absolutely. You learn a lot. I mean, we all started somewhere.
Yeah.
But what we've learned along the way means everything.
Yes.
In critical situations. I mean, I'm sure you as an attorney, there's things that you didn't know when you first started. You learn, and, us as medical staff, when things get tricky, you have to know the tricks to get through it. So.
Right, and that's a good point, because and there's also a huge gap between what doctors need to know and what attorneys need to know, because I've always got time to figure it out. And when I first started doing trials, if I lost some type of evidence